If you're a healthcare professional gearing up for the OET, that speaking module can feel, well, kind of like the final boss in a video game, right? But what if I told you it's not some scary test? What if it's really just a stage for you to showcase the amazing skills you already use every single day? Okay, let's jump in and break down the OET speaking test piece by piece.
So this is the big question, isn't it? And honestly, the answer to this is the key that unlocks everything. It changes how you think about it, how you prepare for it, and it's what's going to let you walk into that test room feeling totally in control and confident.
Here's our game plan for today. First, we're going to reframe what this test is all about. Then, we'll decode the role plays so you know exactly what's coming. We'll get into the 2 grading criteria, I'll give you a practice playbook, and finally, I'll share some of the best prep resources out there. All right, first things first, let's get our mindset right. This is not just another English exam, seriously. It's a simulation of your day-to-day professional world. It's your chance to shine. That phrase right there, realistic workplace scenarios, that's everything. You can forget about abstract, weird test questions. I want you to think about the conversations you have every day with patients, with their families, with your colleagues. The test is designed to mirror that reality, which honestly makes it one of the most practical and relevant tests you'll probably ever take.
Okay, so let's pull back the curtain on the test format itself. Knowing exactly what to expect on test day just gets rid of all those nerves and surprises, right? It helps you put your energy where it actually counts, on the conversation.
So, at its core, the test is a 5-minute role play. You just step into your professional shoes as a nurse, a doctor, whatever your field is, and the person across from you, the interlocutor, plays a patient or maybe a family member. Your job isn't to pass a test. It's just to have a real professional conversation. That's it. And you're going to do this twice. The test is made up of 2 separate role plays, back to back, and each one is specifically designed for your profession. So if you're a nurse, you get a nursing scenario. A dentist gets a dental one. It's all about total relevance to your job.
And you know, what's great is how beautifully simple the process is. For each of the 2 role plays, you get a card that explains the situation and what you need to do. Then the clock starts. You get exactly 3 minutes to prepare, to read it, think about it, jot down some notes. And then it's showtime for the 5-minute conversation. It's simple, it's structured, and it's completely predictable. No curveballs, I promise.
Now, we need to talk about the most important part, how you're actually graded. Because if you don't know what the assessors are looking for, you're just flying blind. It's absolutely crucial that you understand the 2 different ways they're evaluating your performance. Think of it like this. You've got 2 big buckets they're scoring you on. On one hand, you've got the linguistic criteria. That's all about your English. You know, how clearly you speak, your grammar, and so on. But just as important, on the other hand, you have the clinical communication criteria. This is all about your professional skills. It's not just what you say, it's how you say it.
So let's break down that language part a little bit. Intelligibility, that just means are you easy to understand? Fluency, does your speech flow naturally or are you pausing and struggling a lot? Appropriateness, are you using professional language that fits a clinical setting? And then resources, are you showing a good range of vocabulary and grammar?
Now for the clinical side. And this is where you can really, truly excel. They're looking for things like, are you building a good rapport? Are you showing empathy? You know, instead of just walking in and saying, what's the problem? Try something like, good morning, I'm your nurse today. I can see you're not feeling comfortable. Can you tell me a little more about that? See the difference? It's about listening, structuring the conversation, and being great at both gathering and giving information. These are basically your clinical superpowers.
Okay, so knowing the rules is one thing, but playing the game well is something else entirely. So let's talk about how you can practice effectively and turn all this knowledge into a really high-scoring performance on test day. So, smart practice isn't just about doing role plays over and over and over. It's a strategic cycle. You do a role play. Then, you get honest feedback from a study partner or a trainer. Now, here's the crucial step. You take that feedback and you compare it to the official OET scoring guides, which are all available online. Then you figure out what to work on, you refine your approach, and you do it all again.
So during these practice cycles, what should you really focus on? I'd say zero in on the specific language you need in a clinical conversation. Practice your go-to phrases for showing empathy, for explaining a complicated procedure in simple terms, for checking if your patient actually understands by asking, does that make sense? And of course, practice how to handle those really tough conversations when a patient is anxious or upset.
To wrap things up, let's talk about resources. The internet is absolutely flooded with OET prep material. And let's be honest, it can be totally overwhelming. So I'm going to cut through all that noise for you and point you to the best places to get started.
It's a fair question, right? You don't have time to waste on bad materials. Using the right tools from the very beginning is going to make your study time so much more focused and so much more effective.
Okay, here's my curated guide. Your foundation, the non-negotiable stuff, has to be the official resources on OET.com and their YouTube channel. That's where you'll find real sample tests and the official grading criteria. Then, if you want more structured learning and expert strategies, platforms like E2 or Swoosh English have fantastic courses. And finally, never underestimate the power of community. Join some OET groups on Facebook or Reddit to find practice partners and get advice from people who are in the exact same boat as you.
So let's circle right back to where we started. This test, it's not a barrier. It's a platform. It's your stage to show off the communication skills, the empathy, and the professionalism you have worked so hard to build throughout your career. Really, the only question left is, are you ready to show them?